coming to you from our nation's capital, right in the heart of D.C., here at Half Smoke. Now, as you can see, I'm sitting here by myself. The other two ladies are social distancing over in California, hailing from Sacramento. So I'm just the T, and the LC is over in Sac. What's up, girls? How y'all doing?
Make some noise. Woo! Callie in the house.
West Side?
No.
All right, ladies, what are you showing up to the couch with today? What's on your mind?
Oh.
Kennedy, what's on your mind? What you showing up with today?
I miss my mama, y'all.
Aww.
I miss her bubbly personality, seeing her in person, physically kissing and hugging on my mama.
Y'all got to meet her. Y'all got to meet her. We're going to have her to the couch one day. That woman needs her own show. She is a one-woman party.
She has a compromised immune system.
So do I. So I've been very, very cautious about going around her during this time. And I think we both might be at our breaking point.
So what brings you to the couch today, Rob?
What is heavy on my heart right now is what has happened in another city, another time where there's been a shooting. It just really hurts my heart that a young human had to die that was unarmed. And as a mother of a black son, I worry about him all the time. And so that's literally heavy on my heart.
Yeah, we all need to just sit with that one for a moment because I think it's heavy.
Yeah.
All of us and anybody who has eyes.
Yeah, I mean, this will be a topic that we definitely will explore later in another episode of the Pink Couch, but that's just what I'm showing up with today. So, EJ, how are you showing up?
I think the big one that's really on my heart is trust. We're all in these individual places. We're all trying to figure out what the world is going to be for us going forward. Who do you trust? And when there's distrust, can you ever get past it?
Ooh, I can't. I have no evidence of getting past when I've lost trust in someone.
Well,
but we're going to pray for me on that one.
We're going to pray and lay hands on you for that one.
Well, ladies, let's rearrange these pillows and let's get into the heart of our topic today.
let's go.
Let's do it.
On today's Pink Couch, we are going to have a conversation about COVID in the black and brown communities. Now, as someone who's been in healthcare for her entire career, I'm not surprised that black and brown individuals are getting hit 4 times, sometimes a little bit more in terms of dying from this disease. I'm not surprised at all. So we want to make sure we're going to have a conversation that digs into beyond just the awareness, but also what we might want to do about it. So ladies, when we think about what's happening in our communities, what are you thinking? Where are you feeling? Where's your head at? These are unprecedented times.
It's a really interesting time that we're facing right now. There's, on one hand, the joy of being closer to family, the joy of being, this forced connection almost because we don't have the conventional, reaching out, touching, hugging, what have you. And then there's the flip side of we are living in a pandemic. We are living through a pandemic. And this is something that nobody else will be able to tell the story that you're living right now. So I am fired up about change. I'm fired up about there are things we can do to really help and improve the health of our black and brown communities in particular to make this world the world that we really want to live in. But we have to take charge. We have to own it. We have to start today. And so I am happy I'm along this journey with my girls, and we will make change. We will see change, and it starts today.
Joining us today, we have Dr. Rob Gore. He is hailing from Brooklyn. He is an emergency physician at Kings County Hospital in SUNY. Where's Brooklyn at? He's also a graduate of Morehouse. He's the founder of Kings Against Violence Initiative. He's done a TED Talk, something I want to do one of these days. And you might recognize him as a CNN hero back in 2008. And I just found out that he has
I'm not that old.
You see?
Oh, did I say 08? Oh, my bad.
Yes, she did.
See? So, Dr. Gore, as you know, we're here talking today about COVID-19 in Black and brown communities. That's a hard transition. But why are we sitting here having this conversation today in 2020? Why is it still a relevant topic?
Well, I think anytime you're dealing with an issue where there's loss of life, it's always a relevant topic. And, working in Brooklyn, New York, so SUNY Downstate Medical Center, which is where I work in Kings County Hospital, or right in the thick of it. SUNY Downstate itself is the first, has the first designated COVID-19 hospital, meaning that anytime an ambulance comes in with, EMS, which is run by the fire department, anytime they bring someone, they're only bringing cases where people have symptoms that are consistent with COVID-19, which can run the gamut. It's not just a cough, a runny nose, or a fever, or problems with their sense of smell. People can have so many different things that are coming in, but there are a lot of people who lost their lives due to COVID-19, and it's no surprise that this stuff tends to happen at high rates within the African American, Latinx communities, and even the Native American communities.
Why? Why is it really having the impact that it's happening in Black and brown communities and in disenfranchised communities in general?
We already have so many risk factors for so many other medical problems. There's no surprise that Central Brooklyn, we have high rates of interpersonal violence. We have high rates of gang violence. We have high rates of heart disease, high rates of hypertension. And any medical problem you can think of, we're affected and afflicted by it. We have high rates of poverty. We have higher rates of new transmission or new diagnosis of HIV and AIDS. And so when you start factoring a new disease process on top of a community that's already been suffering from major medical problems, it's no wonder it's going to devastate it. You got to look at it. Every disease itself is like a stressor. And so every time you add an additional stressor, it compromises your body's ability to fight off that infection. And there's no surprise that that's happening within our community. If you look at Central Brooklyn, where I work, same thing with Southwest Atlanta, same thing with South Central Los Angeles, Detroit, where I did my residency on the west side of Chicago at Cook County Hospital. Those numbers are a lot higher than, let's say, a lot more affluent communities.
Given that we are disproportionately impacted by health issues, right? Do you think as a community we take our health seriously enough?
I think we as a community do take our health seriously, but we don't always have the exact resources that are necessary in order to be at our best or function in our most optimal state. There are a number of different factors which impact health and well-being, and in the public health space, we call those social determinants of health. Those are things related to the economic infrastructure of your community, easy access and regular access to healthcare, the education quality in that community, even social support systems, to name a few. Those are all the things that impact how well we can fight off infections and whether or not we're in best positions to be able to thrive. And so if you take elements out, or you live in a community where there are food deserts, meaning you don't have access to high quality of food. If you're in a city or in a neighborhood where nobody has a job, or there are very few jobs, or the jobs that are out there are low paying, if your hospital system is already inundated with so many cases because it's one of the only few public hospitals in that area and it's a safety net for everybody else, of course it's going to take a while for you to receive care. It doesn't mean that the care is bad, but it just means that it's going to take a lot longer in order for it to actually happen. It takes a lot more energy and effort to repair your health and well-being if you're already sick than it does to actually maintain a healthy way of life if that's something that you've been partaking in for long periods of time. So I run a violence intervention program called CAVI, which stands for the Kings Against Violence Initiative. And most of the work that we focus on is we're trying to rewrite this entire narrative about violence and trauma. We provide support systems for people who've been injured as a result of violent interpersonal violence. And we have school and community programs which are working with people who are considered to be at risk. When we talk about violence intervention itself, people are really concerned about the trauma. And when you talk about preventative measures, which is more the public health point of view, people don't get as excited. But when you start talking about gun violence and what you're doing in the emergency department, everybody's eyes get really wide, and they were like, "Yeah, tell me about this trauma that you're experiencing." I tell my staff, I was like, people only want to pay attention to the sexy stuff, and they're like, "Oh man, Gore's going to talk about sexy stuff in his talk again." But people really don't. They don't like to pay attention to the long, drawn-out processes that are required to improve an overall infrastructure of an entire neighborhood, but even more so, an entire city, and taking it up another notch, an entire country. People don't want to deal with that because those aren't short-term approaches. It's not a pleasant process that's required to really challenge and restructure and revitalize an entire infrastructure when you're looking at economic development, food access, healthcare access, and every other thing that you can think of.
What's the charge that you would give people? What can they do? Be it people of color, be it others, how do we really address and look at the impacts on our communities, and what do we do?
First, I think we have to be conscious of what we actually put in our bodies. So many people are used to eating purely because it's there, as opposed to using it as something that's an actual fuel, something that can provide sustenance, something that can actually provide overall well-being. You can't really dictate what other people do. You don't have control over what other people do. You do have control over what you put in your system. Right now, we are having to do things that we may not have had to do traditionally. We're having to work out in our home spaces for people who have that luxury. We have to spend time with our family, which could be the gift and the curse depending on your family. I kind of have to make some light of these things because I've seen a lot of death related to COVID-19 from people who are close to me, as well as patients that I've cared for. But you do have to kind of think about, like, how do you maintain your own personal health and well-being? So I'm going to tell you what I do. Because of the trauma that you see on an ongoing basis, you have to develop a practice in which you process it. Now, there was a T-shirt when I was at Morehouse, and it said, "Lead, follow, or get out of my way." And I kind of took it to heart. And so, a lot of people talk about putting up or shut up, and I think a lot of people talk about issues, but can you embody those changes in which you're hoping to administer? Well, it takes even more courage to be able to go out there and implement change and go through the necessary changes that are associated with growing and learning. COVID-19 introduced something into the entire world that people weren't prepared to deal with. But I learned a lot from engineers, and with engineering design process, and what it teaches us is, you identify a problem and you come up with potential solutions for those problems, and then you implement a possible solution. And then after the end of that implementation process, you go back and you reevaluate that. We have to do the same thing for the systems which are in place within the United States and around the world. We have to do the same thing for these different determinants which impact and influence our overall health and well-being. The goal isn't just to keep people alive. We want to keep people alive and thriving. And it's going to take some work, and it's not a perfect process. So this is the beginning, but we're hoping we can mobilize a lot more people who will share the same vision to get these things done. It doesn't have to be identical, but the vision has to be shared.
I think that's exactly you're speaking to the story. And I think there's a big piece, something that you said, and we didn't really get to today, is you really talked about and highlighted this notion of blame. And it's not about blame, but it is about personal ownership. And you've given us the examples of you got to live it. You got to live it and be an example and take control of what you can take control of. So we appreciate your candor. We appreciate your honesty.
Yes.
And most important, we appreciate your service. Thank you. Thank you for taking care of us, all of us. And when I say us, I mean America, us. Thank you.
I'm so excited to bring this next guest to the couch virtually. We have Betty Francisco. She is General Counsel of Compass Working Capital, and she's also co-founder of Amplify Latinx. Welcome, Betty. Welcome to the couch.
It's great to be here. Thanks for having me.
All right, Betty, I am super excited that you're here with us, Afro-Latina, and I always get excited when we can put some more Latin flavor on this couch.
Well, I'm Chino Rican, so Chinese Puerto Rican from New York.
What? Okay. You know what? We've been having a very great and expansive dialogue about COVID, right, and just the impacts that it's had on communities of color. I would love to hear your perspective about, Latin communities and health in general and the trust or lack thereof that we have with health providers, health information, and how that impacts our ability to live our healthiest lives.
Latinos have some of the highest health disparities, right, that we've seen around chronic diseases like diabetes, heart disease, because of often, living in conditions of poverty. And we're seeing, that being exacerbated today because a lot of families cannot access, right, proper health care, or they might be afraid to access it. And in fact, today in Boston, there was a piece that came out around a gentleman that was afraid to go get tested. And in Massachusetts, getting tested for COVID is free and accessible to anyone, even someone undocumented. But this person was so afraid to go that they got sick and passed away. And so it shows there isn't a concerted effort, right, to educate the community around the risks. And these are, Latinos and African Americans are essential workers, right? They're the ones taking the risk every day to work in our stores, to do emergency childcare, to help with transportation. So they are the backbone of our economy, and we're putting them at the most risk and not providing them with information, resources, and, even protective equipment. We know that we have an even bigger healthcare crisis coming down the pike because, again, nobody wants to go to a doctor right now. And so we're going to start to see that start to rear its ugly head.
You have to agree with everything that you said. You talked about a couple things that have my mind going. One is around the fear. And what is we go to a universal and we say fear is driving people not to access care, right? He spent a little bit more time talking about what that is, what that looks like, and it's, it not being just this one-dimensional aspect of that fear. And then my follow-up question is really around when you talked about the education isn't happening in the communities, right? It's not happening in the communities. It's not happening in the language that, that is most relevant to them. What would that look like?
On the fear, I think, a lot of it stems from the larger issue of how, we view immigrant communities, right? The reaction of our administration to immigrant communities. So even if you, are, especially if you're undocumented, right, there is always going to be fear of accessing services. Anytime you have to disclose who you are, where you live, right, there's an immediate fear of I can get, deported. Possibly someone can come after me. So these are individuals living under the radar. That fear is incredibly real because of the circumstances and rhetoric around immigrants. It limits, right, the access that people can get because they just won't go to it no matter what you do. The second piece on language, it is a travesty that, our public health infrastructure, because this needs to come from our government, right? The materials, the disclosures, the fact that there's services available to you for testing, right? You can get tested, you can get care and treatment if you have COVID, or say other, emergency healthcare needs. That is not being translated. And so that is the responsibility, right, not of our churches necessarily, which are, our churches and our community organizations are translating. But it's the responsibility of our governments and public health officials to do that. And so we need to hold them accountable for that. And I would say that and the outreach has to be culturally appropriate also in that, how do immigrant communities, Latin American communities access information, right? It's not in the Boston Globe or the New York Times necessarily, right? It's going to be on radio. It's word of mouth. It's through faith groups, so it's also looking at how do different ethnic groups get their information from, and who do they trust to get that information.
Yeah, and Betty, I want to just lean into the role of churches in health, right? Especially in Black and brown communities. We've established a family, if you will, in the churches that we go to. Most people have long-standing relationships there. And so the trust factor is already built in, right? And so I know some churches are mobilizing around health and helping to close the gap in people getting care, at least, right? Maybe not in the disparity, but getting people to see that they need to get care. What have you seen where you are, sort of how that's being mobilized and what those churches are doing in their communities?
Right. Well, I see some of the Spanish language or Latino churches right there. I mean, they've had to move online, right, because of the inability to meet, and that's hard sometimes. Like these were not. I don't know that they were all necessarily prepared for that. But there is an effort, right, to get information out, right, through online services, for example. There's still a word of mouth and physical meetup component, right? Because the fact is that a lot of our Black and brown, workers are out there, right? They are still providing services to the community. So I think there are some groups that, to the extent you're servicing a food pantry, right, there might be someone from a faith group there that's organizing that. So people are actually meeting and there's an ability to talk about these issues, in person. But I would say I've seen some mobilization around the online and, in a lot of different groups, even not necessarily churches, but community groups holding webinars where they bring a faith leader in to talk to the group, right? So also creating access to faith leaders, to groups that normally don't go to church, right? So that's another way to, I think, that I've seen some outreach being done.
Thank you so much for spending this time with us.
Thank you for having me. Appreciate it.
Course.
And I will say mobilize, advocate, speak up, and be really loud about the needs of our community.
Yes, and yes.
So that concludes this episode of The Pink Couch, where we have uncomfy conversations on the comfort of this beautiful pink couch. Join us next time in a city near you, because the couch only goes where the story needs to be told. Thank you.